Now, there's a lot of stuff covered in women's studies. Have you even started looking at all these different diagnostic tests?
I know it's amazing as a woman that we have so much out there available to learn more about our insides, you know? Like the pelvic ultrasound, for instance. They tell you have to have a full bladder. I mean, really, overflowing is the truth, and it's painful to have your bladder that full, although the test isn't that painful. They have to look at your ovaries and your uterus, and they check the lining, make sure there's no cysts or anything like that. They can do it either on top of your abdomen, or they can do it transvaginally, which is probably much more uncomfortable.
How does that actually work?
I think the pelvic ultrasound, it uses sound waves to bounce off of the tissues and organs, and it shows any densities or like fluid-filled cysts, and you can actually measure everything, and it tells you a lot about if there's any abnormalities or if everything looks exactly like it's supposed to.
Okay.
Before an ultrasound, you have to drink like 24 ounces of water. If you're having transvaginal, though, they want you to empty your bladder first, because you don't need your bladder full during transvaginal.
And I guess they do that if they think there's a problem or something, they need to look closer at it, right?
Right. It checks for the size, shape, and position of your uterus, ovaries, the thickness of your lining, and any kind of changes, even in your bladder shape.
And I know we have to get pap smears every year.
Yeah, PAPs, those are fun.
Awkward.
Yeah. To me, thinking about pap smears, I think about a cervix, kind of looks like a donut. Yeah, it's just a round kind of structure, kind of high up into the vagina, and it's kind of uncomfortable because the doctor has to put like a metal speculum in to open up the vagina to get a really good view, and they shine a nice little light in there. And the pap test, basically, they just take a small brush and they just brush off the surface cells of the cervix just to make sure that those cells don't look abnormal. And they check in for like cervical cancer or any precancerous cells, even they would be able to find that with the pap smear. It's a screening tool.
Is there a special prep that you have to do to get a pap smear?
Yeah, you have to make sure like 24 hours before. You don't want to have intercourse, and you don't want to douche or anything like that. Not use spermicides. And if you're on your period, it's probably best you don't have a pap smear, because those things can cause some things not to be read properly.
I see.
The pap test is usually sent off to pathology, and they can look at all the cells under the microscope and determine if there's any abnormalities there. If it is abnormal, there's other tests.
Follow-ups.
Yeah. You have to follow up with a colposcopy.
Colposcopy, what's that?
Yeah, it's a little more uncomfortable than a pap smear. They put you up in stirrups again. You have to go through the same speculum exam, but they have a different kind of light that looks, it's like a glorified microscope. It's called a colposcopy microscope, and it shines like a different kind of light in there. You can change the settings on it, and usually the doctor will put like a vinegar type solution on your cervix, and that vinegar kind of highlights any abnormal areas. If they see that at the time of the colposcopy, then they can go ahead and take biopsies of those tissues. And they can also do what they call an ECC, which is an endocervical curettage, and that scrapes the cells on the endocervix, because the doctors can't see that really well, but that gives them a little piece of that too, so that they can send that off for pathology. And what it's looking for is any moderate or severe dysplasia that may need treatment.
Okay. Are there any other procedures they do? She wants us to study LEEP.
Yeah, I was telling you a little bit about the cervix looks like a donut.
Yeah.
So if you have to have a LEEP procedure, basically you're looking at a donut hole. They're basically kind of taking out a cone-shaped part of the cervix, and that serves two purposes. It sends off a little bit bigger biopsy of that area, plus it removes those abnormal cells, so that hopefully you won't have any further dysplasia. And so it's really a little more detailed procedure, and you actually have to go in to the hospital, an outpatient procedure, and they use like a loop wire with electric current, kind of cauterizes through those tissues, and it kind of removes all that abnormal stuff. After that, you wouldn't want to have intercourse or douche or any kind of vaginal like tampons or anything until after you're cleared by your doctor, because that area has to heal back up. And then you'll be able to follow up after that for an exam so they can make sure your cervix is healing properly.
One thing, I always take my mother every year to get a mammogram, and she says it's super uncomfortable.
Oh yeah, I just had mine recently, and it's really worth it overall to have it done. It's not exactly painful, but it's not exactly fun. Kind of reminds me of a pancake, because they take your breast tissue and they squish it between two plates, and I mean they squish it good, but it gives them good images. It's kind of like an x-ray picture of the breast. And it can find things way early compared to what you could if you did a self-breast exam. It's used to check for, breast cancers or any kind of small abnormalities. They may be able to find any other disease or anything within the breast using that. Usually a woman gets her first mammogram when she's around 40. And I had mine last year, was my first one. And I really was surprised at how quick it was. And as far as it detecting something early, I think it would be much, much worth it to make sure that every woman knows to follow up and do that. It's very important because they can find things so much earlier. And of course, we know breast cancer treatment, the earlier you find it, the better.
What about a woman, if a woman has breast implants, can she still have a mammogram?
She absolutely can. Usually the diagnostic technician does want to know if you have breast implants because it will definitely look different on their exam.
What about a hysteroscope?
Yeah, hysteroscopy, it's an outpatient procedure done in the hospital where the doctor will actually go in with a scope and look at the inside of your uterus. They can see a lot of different things that way, and it can also, do some confirming. If you had an abnormality on your ultrasound, they'll go in and look inside your uterus to actually see what that abnormality was on ultrasound. It's more detailed because you're actually getting visualization of that. So the best time to do that is during the first week or so after your period. So, and there's not really like an age range or anything that it works better for. It's just if they see anything abnormal on your ultrasound or if they have some suspicions from some symptoms you're having, they can actually go in and visualize that with a camera. Kind of reminds me of like a kebab. They just poke a camera inside you and, you're asleep, so you don't really know. And it's not really painful afterward, you just may have some cramping and things like that. And again, anytime you have a surgical procedure, you really need to make sure that you understand your post-op instructions by your doctor and what not to do. So.
Okay. Well, thank you very much for helping me study. I feel like I understand that stuff a lot better now.
Yeah, it's I've worked in it for 8 years, and so all this is like more in-depth review, and I really, really love women's health. So it's just a passion.